Hey you, hope you're well. Although if you've found your way to this video, it's likely that you've been recently diagnosed with breast cancer and you're in a very stressful time. I feel you. I know what you're going through. In March 2021, I was diagnosed with stage 2 invasive lobular carcinoma. HER2 negative, HR positive. I think I have that right. All these names and letters were very confusing for me in the beginning, and they're not even that vital that you know them now. Right now, what you're looking for is answers, how to move forward, how to know which is the best surgical option for you, whether it's double mastectomy, single mastectomy, whether it's reconstruction, whether it's implants, flap reconstruction, flat closure. There are so many decisions or so many things to research before you make your decision. So today, or here in this video, I want to share with you my process, how I navigated this section where I was trying to choose what surgery to have and just getting comfortable with what my options were and if they were effective, if they were appropriate for me surgically with my surgeon, as well as were they appropriate for my life, for my needs, for my body, for my life experience, for what I needed in my life moving forward. It's a lot to take in. So sit back for a few minutes, just kind of get all that other stuff out of your mind for the moment, and let's just sit, you and me, and have a talk. And I will share with you my experience, how I decided, what I chose, and how I'm doing now, just these few months later. So let's start. I was diagnosed in March, and very quickly I found a surgeon. And so if you're already looking at surgical options, you likely already have a surgeon. Next was what kind of surgery. I was in stage 2 cancer. Mine had not spread at all yet. Very grateful for that. So I had a lot of options. And it's likely that you have options as well. So I had, my cancer was on the right side in my right breast. So my first option was a single mastectomy or a double mastectomy. And for the single, if I opted for the single mastectomy and kept my natural breast on my left side, my surgeon said that she would insist upon a mammogram every 6 months for the rest of my life. Okay, that was not going to work for me personally. I am not a fan of mammograms. I have always had pain with my mammograms for 2 reasons. When I was very young, when I was in my teens and 20s, I found benign fibroid tumors in my breasts. And they were benign, they weren't cancerous, but I had a lump removed from each one of my breasts. So I already had scar tissue. I already had spots that were numb and tingly and didn't feel good to the touch. So I'd already had many, many, many mammograms in my life. And I thought, I didn't need to keep one natural breast. I am 54 years old. It was never going to have children, and I had no desire to breastfeed anything or anybody. So that was kind of my thought process to choose, or for my option to choose, a double mastectomy, which is what I went for. Your lifestyle, your life situation is completely different than mine, I'm sure. So make choices based on what you can manage in your life moving forward. If you have the option of a single mastectomy, are you willing to get a mammogram every 6 months? If you are, that's a great option for you because you keep one natural breast and you really only have one side of your chest that you're dealing with. Research your options. Research your options. I'm probably going to say that 50 times in this video. Just research your options. And this is one of your research bits. So we're figuring it out as we go. Next, after I made that very quick decision, next was the big decision. Am I going to have reconstruction or am I not going to have reconstruction? If I choose reconstruction, am I going to have implants or am I going to try and choose a flap reconstruction, which is using your own body materials, skin, muscles, fat, usually from your lower part of your abdomen, I think, to reconstruct and make breasts. This was really hard for me, and I researched it for approximately a week. And my surgical date was coming up pretty soon because I had a surgical date set long before I knew what my surgery was going to be like. So I kind of felt a lot of pressure here. And you might be too, feeling that pressure of, oh, I need to decide, I need to move forward. And also, this whole time we are walking around with cancer inside of us. And that, woo, I felt a lot of pressure just to move forward, to make my choices and move forward, to get the cancer out of my body. Like that was a very impactful driving force for me. Just knowing that I was walking around with cancer and it hadn't spread yet, or at least we didn't think it had spread yet at that time, because sometimes they don't know if there's been spread or not until after surgery. So, this was a really hard choice for me. So let me go through the process. I was fortunate to have a lot of really good resources in my breast cancer journey because I happened to choose a surgeon who was related to or in the Sarah Cannon Cancer Institute system. So I was immediately given resources. I had a nurse navigator to help me figure things out, and she helped me with a referral to a plastic surgeon. I was faithfully researching each of my options prior to making a choice. That's kind of how I do things. I need to know every option, and I want to know all my choices before I choose so that I know that I'm choosing exactly what's right for me. So again, do your research. So I met with this plastic surgeon one day. My husband was with me, and I met with him in his office, like not in a surgical room, not in a consultation room, like actually in his office. And he talked for 10 minutes straight before I asked a question, or before he even stopped and allowed me to ask a question. So vibrationally, we weren't meshing. Also, I quickly found out that plastic surgeon specializes in implants only. So that's some good information. Some plastic surgeons are authorized and certified to only work in specific areas or with specific materials. So keep that in mind when you're doing your research for plastic surgeons. So this plastic surgeon offered only implants. And I quickly learned that if you opt for reconstruction, not you, I mean we, when we opt for implants or for reconstruction, it is often multiple surgeries. The plastic surgeon that I met with mentioned no less than 3 surgeries. First, there would be the mastectomy. Then there may or may not be tissue expanders. So if after my reconstruction, I did not have enough like skin to put the implants into, I would have surgically implanted tissue expanders that would gradually be increased until my skin stretched to match the size of the implant I chose. Then at some point, those tissue expanders, if they were needed, they are not always needed, but if tissue expanders were needed, I would have to have them surgically explanted. That means another surgery to remove the expanders, and I think the implants would have gone in at the same time. Just know that regardless, in my research at least, most of the reconstruction options came with multiple surgeries. I walked out of that plastic surgeon's office feeling very stressed, and anxiety started to creep in, and over the course of the next few days, I developed some pretty severe anxiety. And so I knew that it didn't feel right. Let's put it that way. When I have anxiety, it means something's not right. So I knew that wasn't right. And I started researching on my own other reconstruction options. And there are other options. Like I said, there's reconstruction. Most of them are called like deep flap. I don't remember all the names. Obviously, it wasn't what I chose. But there are multiple reconstruction options for using your own tissues. One of them that I researched used tissues from under here and tissues from your tummy, and then the surgeon recreates breasts. And I've seen lots of photos in my research, and some of the reconstructed breasts looked really natural. Oftentimes, though, once you opt for, it depends on your stage, I think, if you're able to keep your nipples or not. My cancer was in the nipple, as well as I had a deep tumor. I had no option to keep my nipples, or at least this right side nipple. I had no option to keep the nipple. So sometimes reconstructed breasts have no nipples. And I know that there's people who will do tattoos of nipples that really look realistic. I've seen photos of some of them. It's remarkable. So that in the end, you can look like you have natural breasts. But here's the thing. And I don't know if anybody mentioned this in my research, but I have experienced breast surgery before my cancer. So let me explain, regardless of what option, you will likely feel numb. Even after when I was young, in my teens and 20s, when I had those benign lumps removed, I had scarring, I had spots that were numb, and I have spots that were just felt weird and tingly and odd. It is likely that with reconstruction, whether it's implants or not, that your breast will be numb, completely numb, and lack sensation. It's important to know that going in. But again, I'm going to say it, do your research. And if you are concerned about the sensation or the feel of it when you're done, discuss that with your surgeon. Discuss that with your nurses. Discuss it with everybody that comes around. Look for it in research. Find out. Ask. Ask every question you need to ask before you choose. There are multiple reconstruction options that use your own tissue. So again, do your research. I think some people are more qualified for them. I think it depends on your size and weight, and I'm pretty chubby, so I was a good candidate for most of the reconstruction because I had a lot of skin and a lot of fat that they could have used. And one of the options where they take the tissues from your tummy and move it up, I have a lot of tummy fat, so that would have been a good option for me. And the way it was explained to me is that it's like getting a tummy tuck and breast reconstruction all in one surgery, which sounds great until you consider recovery time. Can't even imagine how much recovery that takes. That was not the option I chose, but you are having 2 major surgeries in one. Something to consider when you make your choices. So, as you can tell, I opted for no reconstruction. My final choice was double mastectomy with no reconstruction. And let me tell you how I got there. So I met with the plastic surgeon who did implants, didn't like it. I had anxiety. I started researching other reconstruction options, and I still had anxiety. So I kept searching for options that made me feel less anxious. So I knew that out there were people who had double mastectomies or any mastectomy, single, double, doesn't matter, mastectomy, and had no reconstruction because I knew that there were prosthetics available. Prosthetic breasts, breast forms, breast pads, I knew there were prosthetics out there. So I went looking at prosthetic options. I wanted to see like what's out there. There are silicone, heavy, kind of breast feeling prosthetics out there. There are lightweight, easy to manage when you have scars and things, lightweight breast forms out there. I also found out that oftentimes insurance companies will pay for prosthetics. Awesome. Talk to your insurance company if you think that's an option, because I don't know, I just think that's pretty fantastic. So I started researching for prosthetics. I found some great companies, and I will link to a bunch of resources below if it helps you. One of my very favorite companies that I ran into when I was looking at prosthetics was Ana Ono, Anaono. And they had bra options for every kind of option that you have, whether it's you just need something after surgery to hold things together, for reconstruction, for lumpectomies. They have bras for everything. They have bras for flat closure. They have everything. And it is a company founded by a breast cancer survivor, and their models are breast cancer survivors. I love them. Like I said, I'll link to them below. But what they showed me was that there are a million options. There are options, maybe not a million, but there's options. So keep looking. When I was researching prosthetics, I ran across the Flatty community. Flatties, as we call ourselves, are people who opted for flat closure. They are people like me where implants were not an option. I didn't want anything implanted into my body. Where reconstruction is maybe not a desired option, which was for me. I had surgeries already on my breasts. I've also had lung surgery. So I had 3 surgeries on my chest before I had cancer. So looking at reconstruction and multiple surgeries, 3 more surgeries to be exact, was not an option for me. I'd already had 3 surgeries. I was already facing a mastectomy. I didn't want any more surgeries on this part of my body. So that for me was a very personal choice. This for you is your personal choice. It's your choice. Remember that throughout this whole process. But when I found flat closures, Flatties, when I found the Flatty community, and I saw how beautiful and strong and brave they are, I found my people. I don't know why I'm crying now. I'm not sad. I'm not crying because I'm sad. I think this is so fresh for me as well. My surgery was in April. It's only been a few months for me. And so I'm very emotional about it. Finding my community was emotional for me. It was a relief. As soon as I found those Flatties, that Flatty community, my anxiety went away. My heart feels joy thinking about strong, healthy, brave survivors and thrivers. That we're okay looking like this. That we're okay being flat. They didn't need breasts to feel good. I am a beautiful and whole and healthy and healing person. I didn't need breasts anymore. My personal decision was to go flat closure. I didn't want any more surgeries. I'm over 50 and didn't need to breastfeed. For me, it was also about that because my breasts had always had scars and numbness and tingling and those sensation issues, I wasn't interested in having breasts for the rest of my life that continued to have those numbness and tingling and those odd sensations. It wasn't worth it for me to look on the outside one way and to feel differently on the inside. I opted for flat closure, and it is the right choice for me. It may not be the right choice for you. Feel into it. Feel into it. What is your body telling you? What is your anxiety signaling you? What does your life need from you? Do you want to breastfeed? Do you want to give up on breasts and shed them forever? Do you never want to wear a bra ever again? I have to say, that's a benefit of having a flat closure, is that after my surgery, I threw away all my bras except for one. I kept one. I kept the one I bought on Ono, the one with my breast forms in it. I kept that one. I still have my breast forms. I haven't worn them in a long time though. And let me explain why I haven't worn my breast forms. It's because after my surgery and my skin and my scars were healing, I began to wear my breast forms. And I began to wear them a little bit by little bit, a couple hours each day, because my skin was very tender and still healing. And then, after I healed from surgery, my course of treatment included radiation therapy, and yours may not. It depends on your cancer, it depends on your surgeon, it depends on how you are. Depends on your diagnosis, it depends on a lot of things. So, this was just my experience. I had radiation treatment. I think it started a couple months after my surgery to give my tissue enough time to heal. So even when I started radiation therapy, I wore my breast forms. And then throughout the course of treatment, my skin became too damaged. And I wasn't allowed to wear my breast forms anymore. I wasn't able to. It wasn't healthy for me and it was very painful. So I put those aside, and quite frankly, they've been in the drawer ever since. My skin has only healed recently from radiation surgery, or radiation treatment, so I probably could wear them if I want to. But after not wearing a bra for this many months, I kind of like not wearing a bra. I am not drawn to my breast forms anymore. And maybe they were good for me, and it was just as a transition from my old body to my new body, because our bodies are changing. You're going to be okay. I don't know what it is though, but I don't feel like wearing them anymore. I haven't worn them in a while, and I'm not sure if I ever will again. But I'm not going to say no. I'm going to leave the option open for myself. So I feel like pro tips. I was going to say pro tips. I'm a pro because I just had cancer recently. I'm not a pro. I'm not a pro, but I've been through it. So let me share with you what I've learned. Let me say, advocate for yourself. Ask every single question that comes to your mind. If you need to, keep a pad of paper handy and write down every question that you have when it comes to you, so that when you go in to see your surgeon next time, you can ask. Ask every question. You are the patient. You're the one in charge. You can ask questions like, is there anything else I need to know that I haven't asked yet? How long is it going to take me to heal? What are the possible complications that I should be looking for as I heal? What else do I need to know? I kept asking that a lot. What else do I need to know? What do I need to know that I'm not asking? Those kind of questions are really great because oftentimes they'll just encourage more conversation. And I found out more by just having conversations with people than I did by doing some of the research that I did. But do it all. Do the research, ask the questions, get comfortable. Just notice how your body's responding to your research and your decisions. What else? Numbness. So like I said, I opted for a flat closure. I also had this, remember, this is my cancer side. I also had lymph nodes removed from this side so they could check for the spread of the disease, which, by the way, mine had not spread, and I'm so grateful for that. But I have damage. I have damage. I have this stuff called webbing. And webbing, I hear that they don't know what causes it. It feels like it's either a tendon or it feels like maybe even a lymph node or something that is pulled. So I don't have a lot of range of motion, and it just looks different. It's definitely deformed. It's not how I was born. So there are side effects. Numbness. I am numb. Okay, so double mastectomy. I am numb from under my left arm all the way across. I have a little sensation in the center because there was no breast tissue there. I am numb all the way over. I am numb under this arm, all the way under this arm down to about here. And the back of my shoulder is also numb and part of my back. Numbness, it will occur because they're cutting through those nerves. And so after surgery, there's a lot of pain with every surgery that happens. After surgery, there's also a lot of nerve pain, which is that pain that just really gets you, where it's like, strikes out of the blue and knocks you on your ass and takes your breath away. Nerve pain. That is going to happen. And it likely means that your nerves are trying to regrow. So it's not always a bad thing. I have regained some of my sensations, some of my feeling, but not a lot. Not a lot. So I felt more numb right after surgery than I do now. And I have to say, I don't have a lot of pain anymore. So this is many months out. My surgery was April 8th. As I'm recording this, it's October 26th. So this many months out, I still have pain, but it's not as frequent. And it's typically when I'm pushing my body harder. You're going through a lot right now. You're going through a lot. There's a lot going on in your head. You have so many decisions to make. You will likely be preparing for surgery. There are lots of lists and resources that you can find for the things that you'll need for surgery and how to prepare. Lots of resources out there. Look for that. There are tools and things that you need afterwards that will really help. One of them that I used was a pillow system called Sleep Again Pillows, because you're kind of, okay, first of all, you are in this position. It's called T-Rex. And so you kind of can't move from the T-Rex position. Everything is here. So a couple of things. I needed pillows to kind of prop me up in bed and keep me in that position. Sleep Again Pillows help me. I'll link to them below. So I chose flat closure because it was right for me, for my age, for my lifestyle, for my medical history. I chose double mastectomy again for the same reasons, for my medical history and for what I could deal with moving forward in my life. Do your research. Do what's right for you. Do what feels right for you. You are the patient. You're going through a lot. Gather all the resources that you need. Do what you need to do. Make the choice that's right for you. And know that you will survive this. Your body has cancer, but your mind and soul are strong. Lean into your spiritual practices. Lean into your friends group. Lean into the cancer community. Lean into your healthcare providers. Lean into people for help. You need help. And there are so many people that are willing to help you. There are former breast cancer patients or current breast cancer patients, survivors, thrivers. We're all in this little community. Many of us have built businesses on this afterwards. Seek them out. Seek out the ones who will take care of you and who will love you and who will listen to your needs. Another thing that really helped me out was seeing the Flatty community. I wanted to see what it would look like if I had reconstruction. I wanted to see what it would look like if I didn't have reconstruction. I wanted to see the bodies afterwards. So I sought out pictures, and Instagram was really great for that, for me at least. I found lots of representation on Instagram, whether it was reconstruction, non-reconstruction, women of color, survivors, thrivers. Seek it out. I'll link to some beautiful accounts below. I want to be that support for you. So I'm going to show you what I look like. Now, mind you, I'm 54 years old. So, and I've had multiple surgeries on my chest prior to mastectomy. So, be kind. I'm an old lady helping you out. Okay, I still don't have my range of motion, so how I get it in and out of my clothes is still kind of modified. because I can't really reach over my chest yet. Oh, I'm really going to do this. Okay, so if you are curious about what flat closure looks like, ta-da! That's me. That's flat closure. I'm sitting down, so this doesn't look right. Okay, so that's my scar. This was my non-cancer side. And I don't know if you can see it on camera. It's a little darker right here. See how I'm kind of tan? I'm not tan. I'm pale as can be. That is the scarring left over from the radiation therapy. I'm still healing from that. So this was my cancer side. You see they don't look even. Again, radiation changes your skin and everything. So bear with. So this is what I was talking about, the webbing. I want you to see both sides. You see how this side, I don't have full extension and it's kind of pulled down and it's got this funny shape in there. That's because that's what the webbing does. And I'm sorry, I just got to stretch it out right now. This is what flat closure looks like. If you can live with this, this might be an option for you. Okay, get dressed back. Cut. I'm going to get dressed. It really doesn't matter which option you choose. It really doesn't. And I mean, yeah, you're coming here for support, but let me tell you, don't rely on anybody who hasn't been through it yet. Do not talk to your partner about it. Do not get their opinion. They don't know what you're going through. They don't know what it feels like to have cancer, likely. They don't know how terrifying it is to have these ticking time bombs on their chest. It's your decision, and you're going to get through this. You're going to get through this. I did. I mean, I'm still healing. I'm still within my first year. And I just had my 6-month follow-up with my surgeon, and she says I'm looking good. So this is what flat closure looks like if it's an option for you. I am happy to be supportive of you. I support any decision you make because it's none of my business. It is your business and business alone. And if someone asks you questions, it's okay to say, I'm not comfortable talking about that right now. I'm still making my decision. No, I haven't made my decision yet because I'm still researching. It's your decision. It's your business. It's your body. It's your temple, as they say. You make the decision that's right for you. Whew. I can't believe I just did that. I can't. I'm telling you, at some point, cancer made me really, really brave. It empowered me to make the decisions for my life, my body, my future. And it made me feel brave in the end. So I know you're going through the shit. I know it's not easy right now. I know you're scared. I know you're tired because you likely aren't sleeping that well. And you're probably having pain from your cancer. I hope not. But just know that there are so many of us survivors out here. Patients, survivors, thrivers, we're here. We see you, we love you, we support you. You will get through this. I wish you all the best. I wish you a safe and healthy process. Remember, this is happening to your body. It's not happening to you. Your body has cancer. You are strong, capable, whole. Your body has cancer. You're going to do the self-care. Basically, you're going to become the queen of self-care. And you will get through this. And you are beautiful inside and out. Come back if you need help. Contact me if you need help. I love you so much. You will be a survivor. I love you. Be well.